admits such bright and passionate future doctors, all gathered with one purpose: to learn, grow, and walk this journey of medicine together, with faith as our foundation and excellence as our goal. Before we begin, let's start our gathering in the best possible way with the recitation of Holy Quran. I'd like to invite Brother Abdul Hamid for the firat. May Allah subhanahu wa ta'ala bless this recitation and allow the words of Quran to fill our hearts with light, peace, and purpose.
إن عذابها كان غراما إنها ساءت مستقرا ومقاما والذين إذا أنفقوا لم يسرفوا ولم يقتروا وكان بين ذلك قواما والذين لا يدعون مع الله إلها آخر ولا يقتلون النفس التي حرم الله إلا بالحق ولا يزنون ومن يفعل ذلك يلقى أثاما يضاعف له العذاب يوم القيامة ويخلد فيه مهانا يضاعف له العذاب يوم القيامة ويخلد فيه مهانا إلا من تاب وآمن وعمل عملا صالحا فأولئك يبدل الله سيئاتهم حسنات وكان الله غفورا رحيما ومن تاب وعمل صالحا فإنه يتوب إلى الله متابا والذين لا يشهدون الزور وإذا مروا باللغو مروا كراما والذين إذا ذكروا بآيات ربهم لم يخروا عليها صما وعميانا والذين يقولون ربنا هب لنا من أزواجنا وذرياتنا قرة أعين وجعلنا للمتقين إماما. صدق الله العظيم. Now I would like to translate the verses which I recited just now. From 61 to 67 in Surah Furqan, Allah subhanahu wa ta'ala mentioned, "Blessed is the one who made consultations in the sky and placed in it a burning lamp and a luminous moon. And he is the one who made night and day follow each other. For anyone of who you wishes to remember or be thankful to him can be thankful. The servants of most merciful are those who walk on earth humbly, and when an ignorant person addresses them or talks harshly to them, they reply with peace, and they spend part of the night worshipping their Lord, standing and prostrating. They say, "O Lord, keep the punishment of hellfire away from us, for it is indeed truly a terrible place. Indeed, it is an evil place to live in." And they are those who, when they spend, are neither wasteful nor stingy, but they spend in moderate. Next. And they and now come to the translation of verse number 68 to 74. And they do not call any other deity other than Allah, that means those who do not commit shirk, nor they kill anyone whom Allah has forbidden to kill except with justice, and those who do not commit adultery. But whoever does that, their punishment will be multiplied on the day of judgment, and they will remain in it forever with humility, except with humiliation, except for those who repent, believe, and does righteous deeds. For them, Allah will not only forgive, but also replace and convert their evil deeds into the good deeds. Indeed, Allah subhanahu wa ta'ala is ever forgiving and most merciful. And whoever repents and does good deeds, truly he has returned to Allah subhanahu wa ta'ala with sincere repentance. And they are those who do not bear false witness. And when an indecent person or useless talk occurs, they pass through them by dignity. And those who, when they are reminded of the verses of their Lord, they do not fall upon them deaf and blind. And those who say, "O Lord, grant us from our spouses and children comfort to our eyes, and make us leaders for the righteous." Jazakallah khair.
Subhanallah. That was truly heart touching and soul soothing. May Allah reward you abundantly, Brother Abdul Hamid. Ameen. Before we, before we move ahead, let's take a moment to remind ourselves of who we are and why we are here. IMSA, the Initiative of Medicos for Service and Academics, is a non-profit initiative built by medicos for medicos rooted in the values of faith, knowledge, and service. Our mission is simple yet powerful: to nurture doctors who heal with both skills and sincerity, guided by compassion of our deen, because at IMSA, we believe that medicine is not just a career, it's a form of ibadah when done with right intentions. Today's session is one that truly connects with every third year student because it's all about learning from those who have just been in our shoes. We have invited some of our brilliant seniors who not only aced their exams but did so with grace, consistency, and faith in Allah. They are here to share their personal strategies, tips, mistakes to avoid, and how to study smart, but not just hard, especially for the two pillars of the third year, FMT and SPM. So sit back, take notes, and most importantly, take inspiration. So now let's begin our session with forensic medicine and toxicology, a subject that blends science, law, and medicine. Our first speaker is Sister Jabin Mustafa, who secured distinction in FMT. MashaAllah. She'll be sharing with us how to approach FMT systematically, from theory and practicals to case discussion, spotters, and how to handle the viva confidently. So if you ever wondered how to make FMT less confusing and more interesting, this session is definitely for you.
Assalamu alaikum warahmatullahi wabarakatuh, everyone. Thank you for joining today's session. I'll be presenting a quick guide on the key resources and strategies for FMT. Inshallah, this will be helpful in your final exams. FMT is one of the most easy subject and scoring subject. Compared to SPM, which is vast, this will be, inshallah, will help you score more in the total of third year scores. These are the resources. First, the synopsis of forensic medicine and toxicology. Narayan Reddy is the standard, but if you have not touched until now, then there is no need. But if you have followed it from the beginning of the year and made notes out of it, you are good to go. Followed by this review book of FMT by Gautam Biswas. It has MCQs with good diagrams. This, along with the Khazi, can be used if you're aiming for high scores in the theory exam. Khazi Mudabbir is the student-friendly book, loved by most of the students, concise enough, but remember, every line is important as topics are already concised. Online resources such as from Marrow faculty, Dr. Magendran sir, few starting videos of forensic medicine from Marrow are very helpful. This is the arbitrary weightage as follows. This is variable, not a standard weightage. Every year it varies. You can follow this in your revision schedule and revise accordingly. How to write an answer in FMT. First, neat presentation, point-wise answer is very important. Also, underline the keywords, as when the examiner has a certain time limit to correct every paper. So it will be helpful if you underline the keywords, and it will impress the examiner on how good you presented the answer. Followed by all legal definition mentioned in the book are very important, especially for rape, injury, hurt, grievous hurt. All legal definitions are very important. Make sure you write every word from the textbook, very important. Followed by diagrams, especially in the injuries chapter. It is not necessary to draw the perfect diagram. Even if it represents what you are writing in the answer, it's good. You're good to go. Followed by BNS and BNSS sections, very important. Make a list of all BNS and BNSS sections on the paper and keep it handy. Revise every day after Fajr or after starting FMT every day. You can recall it from it. And then followed by medical legal importance. It is very important for every answer in FMT. There is a pattern for FMT answer. In that, medical legal importance is what examiner looks for while correcting the paper. So it's better to make all list of this section at one place. And then followed by toxicology answer. You have to write starting how you will start writing the toxicology answer is you have to write about the poison first, then its action, how it acts. Then remember the fatal doses are compulsory for very important answers of previous year questions. It can fetch you more marks. As for sulfuric acid, its fatal dose is 15 ml. You have to write that as it also causes vitriol, as is a medical legal importance of that. And the clinical features, its treatment, and post-mortem changes and MLI for every toxicology answer. It's important. Also, I would suggest to underline the keywords again because it is very important in professional exams. Then this, if you have not made your own schedule till now and you don't know how to revise FMT, as there is only 16 to 17 days left for your final exams, this is an example schedule that I followed for my final exams for FMT. You can make your own accordingly or follow the same. Inshallah, you will get good score. These are some mnemonics that I made, or you can use ChatGPT, AI, DeepSeek, anything. This is for the difference of laceration and chop wounds. Differentiation tables are very important in FMT. strangulation versus hanging, antemortem burns, postmortem burns, antemortem and postmortem wounds, and then laceration and chop wounds. These were made by me and my friend while discussing the answer. You can always make your own, and it helps you in recalling the answer. And these are some more mnemonics. In toxicology, you can make mnemonics so that it is easy to revise in before the final exams, inshallah. These are the diagrams that I was talking about. It need not be perfect, but it should show that you know the basics of the FMT. This is a diagram for entry and exit wounds. I referred it from the Gautam Biswas textbook. It has very good diagrams. You can follow it. And Khazi Mudabbir also has its own mnemonics and diagrams. You can always use that. For practicals, if you have already attended your pre-final practicals in your college, then you know what is the pattern. And this is the layout of how practicals are. First is the wound certificate. In wound certificate, you will be given a card, and then you have to write about what is the wound, its type, its shape, what dimensions is it, its medical legal importance, and stuff. Then followed by MCCD. You will be given a form to fill the MCCD in a case. Then followed by radiological age estimation. You will be given x-rays of every bone, and you have to write the age, estimated age. Then followed by sex determination from skull, pelvis, and age determination from mandible. Followed by spotters. Spotters contain snakes and scorpion, snakes, plants, chemicals, poisons, seeds. Then examination of rape and victim, followed by, or you will get victim or accused, one of the other, or the drunkenness certificate. For the fetal autopsy, there were some doubts on fetal autopsy on how to write fetal autopsy. So I've attached here a format. Here you will be given a card if your college, I don't know what your college follows. So in Shadan, we'll be given a fetus in the jar, and we have to write our own format. We will not be given any performer or such. We'll have to write on our own. This is the format. First is PMC number, batch number, resignation number of the constable, date, time. Then history of birth. What was the name of the baby? If given, a baby, male or female, was born by history given on the card, you should write that. And then external examination. Measurements, body weight, crown heel length, head circumference, abdominal girth. If the fetus is in the jar, you cannot measure its weight, crown heel length. Just mention the side headings and leave it empty. Then external appearance, clothing present or not, injuries, if any, mention that what type of injury is present or location of injury. Then sutures present or absent, incision over the joints. Then marks of previous autopsy, description of postmortem changes in detail, such as maceration and rigor mortis if present, such then macerated fetus looks coppery red in color, and body parts are flaccid and flatation is present when placed on the table. Flatten when placed on the table. Bone appear to be separated. These are the signs of macerated fetus. If these are present, you have to mention it. And then followed by examination of head, scalp, hair present or not, and if present, what is the length, congenital anomalies present or absent, hydrocephalus, microcephaly, anencephaly, injuries, contusion, laceration, caput succedaneum, cephalohematoma present or absent. Then same for eyebrows, eyelids, cleaved or not cleaved, injuries present or not, nose, same congenital anomaly, injury, nasal aperture, foreign body present or absent. Then mouth, same anomaly, injury, foreign body. The neck, congenital anomaly present or any injuries present. Then on the chest, how is the skin? What is the color and appearance? Is it wrinkled or smooth? What is the shape? Compressed or flat chest? Lanugo hair and vernix caseosa is very important to mention here. Then in abdomen, skin shape, again lanugo hair, and umbilicus position is very important. Umbilical cord, whether it is ligated or not, is very important. And then vernix caseosa and injuries. Followed by external genitalia, male or female, whether labia majora is present, or scrotal sac is present, or any injuries present in the external genitalia. Upper limbs, again injuries and nails present or absent. If present, what till what it is extended to the tip of the fingers or not, if it is covering the nail bed, and then lower limbs, injuries, contusions, laceration present or not, and then at the end, your opinion, that what is your opinion based on what fetus was given to you, age, viability, if it is viable or not. It's very important to mention this, whether it is stillborn, live born, or dead born, and then the cause of death, whether it was natural or unnatural, and then the signature and the name. Then these are the viva questions. Frequently asked, not necessarily that it is asked, and इसके अलावा भी बहुत सारे चीज़ हम पूछ सकते हैं. It's up to the examiner or the external. For wound certificate, you must remember the definitions of injuries, its classification, mechanical injuries, thermal injuries, chemical injuries, all the poisons that will cause injuries, such as vitriolage, sulfuric acid and stuff, simple hurt, grievous hurt, all 8 causes of grievous hurt. It should be on your fingertips, and its BNS sections. Burns, what is burn, difference between the antemortem and postmortem burn. Usually, what wound certificate you will write about, like suppose if you have wrote about the fracture of lower limb, suppose if the person was into the road traffic accident, they will go in detail about the road traffic accidents, what a bumper injuries and stuff. And if you were given a card of burn injury, burn this, and examiner will ask you about what type of burns, and then what are scars, antemortem versus postmortem burn. It depends on what you will get in the exam. And for the x-rays, medical legal importance of age is very important. There is a box given in Gautam Biswas in the identification chapter. It comprises of all the ages and its medical legal importance of that age. For examination of victim of rape, legal definition of rape is important, and its latest BNS and BNSS section. And also external asked me about what is the full form of BNS and BNSS. It was a very basic question, but it was nice. Then for accused of rape, impotency, its definition of impotency, sterility, sexual perversions, transvestism, voyeurism, bestiality, sadism, all these definitions are important if you get rape question. Then what is smegma? For fetal autopsy, rule of Hasse, rule of Morrison, what is the difference between dead born, stillborn, live born, difference between caput succedaneum and cephalhematoma, appearance of vernix caseosa, lanugo hair, definitions of infanticide, feticide, and also the natural and unnatural causes of death of an infant. And then what is the viability of the infant, battered baby syndrome, Munchausen syndrome. These are very important for fetal autopsy viva. Then for drunkenness, its definition, its clinical features, then medical legal importance, and then grading of alcoholic based on blood alcohol levels, and conditions that resembles drunkenness, Widmark's formula, and then how the blood is collected for testing an alcoholic. So these are some important questions external can ask in the viva. Any questions you guys have, you can unmute yourself or ask in the chat box.
Okay, Jabin, there's a question in the chat box. Somebody asked, is it important to remember every BNS and BNSS sections?
No, it is not important for every. For like previous year questions के लिए तो at least आपको याद रखना चाहिए. और वाइवा में स्पेसिफिकली मेरे को जब रेप का क्वेश्चन आया था एक्यूज्ड का, तो मेरे को पहले वही पूछे थे कि रेप का बीएनएस और बीएनएस सेक्शन क्या है. So it is the first question the external expect an answer from you.
Okay, actually, I want to say that we'll have the question and session, and after having both subjects के बारे में जब discussion होगा,
Okay,
उसके
okay.
बाद question and session रखेंगे.
Okay, inshallah. Okay, then I'll stop the
Yeah.
Keep sharing. Okay.
Jazakallah khair, Sister Jabin. That was so clear, concise, and motivating. You have really simplified FMT for us and shown that it's not just about memorizing laws and poisons, but about understanding real life application. May Allah reward you for sharing your valuable insights. I just hope that this session helped you guys and cleared some of your doubts. Please respond in the chat box. All right, then, we are good to move forward. Next, we move on to the community medicine, SPM, a subject that teaches us how to care for populations, not just patients. Our speaker for this session is Dr. Laha Sayed, who also secured distinction in SPM, mashallah. She'll be guiding us on how to prepare for SPM effectively, how to handle theories, diagrams, statistics, surveys, and how to make subject both practical and enjoyable. So if SPM feels endless and confusing, don't worry. By the end of this talk, inshallah, you'll know exactly how to tackle it with confidence and strategy.
Assalamu alaikum wa rahmatullahi wa barakatuh. Am I audible? Okay, I guess I'm audible. So while I figure out how to screen share, can everybody in the chat box just tell me if they are underconfident with SPM? So is my screen visible to everybody? Okay, so one thing before starting, I want to tell you guys is that everybody is worried about passing SPM. Nobody's thinking about distinction and SPM, right? So when everybody is worried about a subject, then you should enjoy that subject because then that can be yours alone, right? So I want you guys to approach it in this manner. So is distinction possible? Is not the question. The question is, do you want the distinction? Okay, so let's start. So these are the contents that I want to go through, and then hopefully we'll be able to figure out from there. So basically, why do you all think that SPM is valuable? Of course, yeah, everybody knows the reasons of community medicine. Everybody knows how important it is. We study it from first year to third year, right? But you guys are also not understanding that later on, when you have your own research opportunities, when you want to apply outside, you will be expected to know the basics of statistics. You'll be expected to know how to read a research paper. You'll be expected to know Z score and SD values. So for that, you need to treat SPM like it's valuable. Okay. Now, these right now in Telangana, these are some of the books that are very famous, right? So you have the standard textbook, which is Park. Okay. Then you have exam manuals like Vivekjan, and then you have notes. So Falcon and Sia's notes are something that everybody knows about. And we also have smart notes and other such annotated notes, right? Everybody is scared of Park. Why? Because it's a big book. Because I've heard people say it's unnecessary stuff. It's just written. It's written like a storybook. You have to read like a newspaper, right? So when are you going to use each of these books? Are you since there's a month left for the exam? I want you guys to reply and tell me which book you all would prefer, and then we'll come back to the slide, inshallah. Okay, keep this in mind. But tell me which book you all prefer. Okay. So this is roughly the paper distribution and weightage. Okay, so you have paper one and paper two. So your target has to be over 70, 75 in each paper if you want a distinction. Okay. As much as we give the weightage, it is upon the examiner to choose how much he's going to use of the chapter itself. So the weightage is there. You can use this and you can study based on that. But what I want you to focus on is the subjects that you're good at. So you look at the subjects that you're good at and you look at the subjects that you're not very good at. Okay, now this will be further explained by this. this is what I used. Okay. So what I use, I'm going to explain to you guys. You have a question bank, whether it's digital, whether it's paperback. You sit and you mark last 10 years in the question bank. Okay. That's going to be more than enough. Right now you have 1 month, last 10 years is going to be more than enough. So you have numbers given, right? 1, 2, 3, this question. You circle it, you circle each number and you say, okay, these are the last 10 years. Okay, this is important. The circling is important. You know why? I'll tell you why. Okay, so what you're going to do, how you're going to do PARK. This is not about notes. This is not about exam manuals. This is about PARK. Can you do it in 1 month? I did it in 1 month. Okay, and I am not a great student. I'm a very average student. So how did I do PARK? So either you go on YouTube or you go on Marrow or you go on Prep Ladder or whatever it is, and you watch the video. Last 10 years, first question you've marked. Now you go to the video, you check that part. It's going to be maybe like 10 minutes, for example. You watch that video on 1 time, 2 times speed. Okay. And you make rough notes just to keep your mind engaged. You're not making serious notes. You don't care about this. It is just to keep your mind engaged. You do that, you have an idea of what you're studying. Now you open PARK. Now you do your first read. First read. Don't touch a pencil, don't touch a pen, don't touch a highlighter, nothing. You do first read. You just read what is going on, what are they talking about. I want to understand this. Got it? You did that. So you have your rough notes, you have your first read. Now, second read, you already know what is important. You already know. Like everybody already says, Ki PARK has a lot of unnecessary things. So what are necessary, you will know after you do your first read. Now you go second read, you take a highlighter and you highlight the important points. Got it? Now your third read is when you will read the important points, the highlighting points. So you'll go through everything quickly. Okay. Now what you're going to do, I know it seems long, but trust me, it's not long at all. Okay. Now you did your third read. Now you're going to have to coordinate with your video notes. So the rough notes that you made, you don't make it that rough where it scribbles, but you make it rough in a way that you can read it. It doesn't matter who can read it or not. As long as you can read it, it's okay. Now coordinate with your video notes and your third read. And now you're going to explain this answer to yourself. You're going to understand this answer, right? Now, what I had was I had a group with my friends, my friend group. And over there, it was just an exam related group, right? So over there, for every single question, I would put a voice note saying that, okay, this is the question and this is my voice note for the question. And I'm recording the voice note. And if I struggle to explain in between, I stutter, then I scrap the voice note and I do it again. Why? Because the more times I do it, the more times I'm training myself to understand the answer, right? So it might seem like it's a big process, huge process, but when you mark the last 10 years questions, you realize that the questions are repeating themselves and they're not many. And what matters over here is that you understand it. Okay. Remember when I said that PARK is extensive, this, that, all of that? It's very extensive. Sometimes I feel like I can't read it. It's better to read a newspaper. But what is the good point about PARK is that you're going to have subheadings, right? From the subheadings, you need to, when you've read so much on a subject, when you've read 2, 3 paragraphs on the paper, after you understand this, you're able to produce at least 1 paragraph. Okay. Whereas if you had read notes, you would have had to know every single line of the notes. Okay. And it wouldn't be based on conceptual understanding. So when you're doing this, when you're taking a video, rough notes, first read, second read, third read, and this goes for any subject, but especially for PARK, and then you coordinate with your rough notes. Then you send a voice note to your friend group until you're perfect with that answer. Okay. That's what you're going to repeat the study pattern. Now, why am I talking about this voice note so much? Why is it so important? Because later on, 1 day before the exam, 2 days before the exam, you don't have the time to, you don't even have the mental space to open up PARK again. It's a beautiful book, but you don't have the time and the mental space to open it up again. So at that point, you have your highlighted notes ready. You have your PARK, you have everything highlighted. So you play your voice note. It's your own voice. It's playing on 2 times speed. You're understanding it. And then you're looking at the highlights. And that's how you do recall. Okay. Now, why did I say that circle thing was important? 1, 2, 3, 4, 5, 6. Let me see if I can do it here. Okay, I hope it's visible, but let's say it's 1, 2, 3, 4, 5. These are the questions in your question bank. Okay. Now, when you circled it, like 1, 2, and 3, these are from last 10 years. Okay. You get one shot of dopamine, right? Now, when you finish the first question, when you finish your all of these 6 points, you finish it, you send the voice note. When you finish it, now you put a tick. Oh, sorry. Yeah, okay. Now you put a tick, right? This is your next shot of dopamine. When you do this, you're training your mind to have fun with the syllabus. You're training your mind to enjoy this. And keep in mind that anyway, nobody enjoys this subject. No offense. It's a very fun subject, but nobody enjoys studying the theory part of it. So if everybody is already lagging behind, then you have something that you can build upon, right? So how are you going to structure your answer? Okay, for example, normal distribution curve. This is a short question that will always come. You talk about it a little bit. You don't directly go into the diagram and you don't write paragraphs. The examiner will not have the time, but you also have to fill the paper. And you have to fill the paper with knowledgeable content, not useless stuff, right? So you fill it like this in bullet points. Understood? Now, this character, look at this, just look at this. This characteristics, we could have done that in one sentence, right? What was the need? What was the need of putting these into like multiple like bullet points? It was so that we expand the paper, right? So we are writing more things and it's easier for the examiner to view. What you have to think of is the examiner who's reading your paper also wants to enjoy. They also want to see a good paper, aesthetic paper, all of this. Like how this PPT is low-key aesthetic, right? Examiner also wants to see that. Okay, so when the examiner sees this, when the examiner has this diagram explained, now you're going to talk about this diagram below this. You're going to talk about Z-score, SD, cutoff values, the uses of this. Okay, everything you're going to talk about, it's going to add up to 2 pages. That's 5 marks. The examiner gets happy. In an LAQ, you will not get full marks. In MCQs, you might get it wrong. But in 5 marks, they want to give you the marks. Nobody wants to fail you. They want to pass you. Okay. Now, apart from this, let's say that there's something that has no diagram. Okay, let's say it's something about family planning, or it's something that's like a nuclear family or types of families or something. How are you going to do that? That you're going to do by using subheadings. Now, this is where all that stuff we spoke about Park. Okay, now that is where this would be helpful. You write your subheadings because you've recalled it so many times listening to the voice notes. You've heard the voice notes twice, you've seen the book, you've done your reads. Now you know what is what. Even if you don't remember the 3 paragraphs, you're going to remember 1 paragraph and you're going to find it interesting. Types of family. Don't you find it interesting? Something as simple as that, something as simple as community medicine, which can be interesting, is taken as a lot of knowledge. But you have to make it interesting. Did you even know types of families in India? Or, for example, panel discussions or something of that sort. Okay, you're getting tired. You know what a panel discussion is. You've gone to conferences, you've gone to your symposiums, everything. You know what a panel discussion is. But how about you watch a YouTube video for it? It's 1 minute, but you'll remember it in your mind that I watched a YouTube video. And that's it. That's it. That's all you have to do. Understood? So we did the subheadings that everybody keeps talking about. Any senior that you go to will talk about subheadings. What is the subheadings? In Park, you're going to have, you just open your Park textbook, open any question, and you'll have subheadings apart from the main heading. So you remember the subheadings, and the 3 paragraphs that you read will be concise to 1 paragraph when you're writing the exam. Okay. Hopefully you guys didn't sleep. Please wake up. Okay. Now you're obviously going to have diagrams. Now over here, you want to explain everything with diagrams and flowcharts. You want to explain, because think of it like your student is coming. Okay, you're tired from work. Now you have to check papers. You have to review papers. You want to see diagrams in the papers. You want to know that your student has understood what he's writing about, right? So for that, you have to be kind to the examiner. And by that, I mean that you have to be aesthetic when you're writing your answer structure. Okay. Bullet points, leave space, everything. So we discussed that. Okay. Now theory versus practical. See, in theory, you're going to have to keep a target. You're going to have 2 papers, right? You have to keep a target of 70 plus in each paper. Okay. Sometimes it'll go really well. Sometimes it won't go well or whatever. None of that matters. What matters is your target. Okay. Answer the questions in a structured manner. Answer the questions 1, 2, 3, 4. Answer the questions in numeric order. Okay. If you want to do short notes first, completely understandable, but answer it numerically. You think that this might not make a difference, but it does make a difference. When the examiner, again, think of yourself as the examiner. When you see something as 1, 2, 3, 4, it also a little bit shows your bravery that you're able to continue it, and that you have that much knowledge to fill the gaps. You're not going 5 and then 8 and then 10 and then, okay, I remembered this and come back. It's very confusing for the examiner. Again, be kind to your examiner. That's what you're going to have to think. Okay. Leave no question blank. Everybody knows this, leave no question blank, but especially in SPM, you know everything. Okay, you know everything, whether you want to or you don't. Somehow or the other, you know it because you live in the city, you are a medico, you've been going to your postings, you know it. You just have to think. Okay, leave nothing blank because you might think that it's useless information, but it's actually very important information. Okay, for a medico, everything is useless information because we're very used to it. Okay, but these things are important. So leave nothing blank, use your knowledge. You are not stupid, you're very smart, and you can recall something and you can write it down. Okay, diagrams, flowcharts, everybody already knows about this. Now, also, when you're writing something, okay, sometimes we write it in a sentence, and the sentence in itself might have one keyword which is eye catching, but sometimes the examiner will not look at it. So you have to underline it. Okay, now also keep in mind that since now they're being scanned and then viewed on monitors and everything, highlighting the way that we used to is not going to work because it might just block what you've written. So underlining is the best option that you have. Okay. Now, practicals. One thing that I want to tell you guys that anybody who's listening to this is that you do not have to rag your junior to have an interaction with your junior. Okay. It is the responsibility of a senior to interact with the junior and make them feel safe. Okay. So your practicals are dependent, they're variable based on college. Colleges have different practicals, right? Like how Jabin said about FMT. When you have a good bond with your senior, you with your immediate senior and your late senior will help you in the exam. Not with cheating, I'm not encouraging cheating, but apart from that, she will help you with like, oh, if is this the case that you want? Let's see, I'll give you the case. Okay, just something as simple as that. Oh, is this the patient that you want? Something that'll nudge you in the right direction. Okay, bonds with your immediate seniors will tell you how their practicals went. Okay, so all of these things are very important. You might think that you're fine with just studying and studying and studying and not interacting with anybody, and you might think that you're an excellent senior because you're not interacting with any juniors. That's absolutely not true. And you might think that you're an excellent junior by not interacting with any senior. Absolutely not true. Interact with your juniors, interact with your seniors, build a network. Okay, that's how you're going to understand how to give your exams, and apart from that, how to even later on in your life. Now, what is most important is that you judge your viva professor. In SPM, you're going to have cases and you're going to have vivas, grand vivas, based on all of the chapters, right? Chapters will get divided between the internals and the externals, whatever. You need to know your internals. Okay, I don't care if you've not gone to any postings, I don't care about anything else. You are going to go and you're going to meet your professors within this 1 month. Okay, you have 1 month, right, before your exams. So you are going to meet your professor in that month and you're going to understand your professor, right? You're going to at least let the professor know your name. You should be known within your professors, right? Okay. External, you can't control, but external professors are very nice because they just want to pass you. They're very sweet. They just want to pass you. Okay. So at that point, that is when you will actually try to see what the professor wants from you, what the external wants from you. Do they want you to give the answer immediately? Do they want you to delay it? Do they want you to say that no sir, I'm not aware of it? Okay, don't sit there silent. If you don't know something, sir, I'm not aware of this, can you please explain it to me? Ma'am, I'm not quite sure about this. Some might be okay with the explanation and some might not. You just got to know that, and it's a skill that you will develop. Okay, one thing, please learn from my mistakes, is don't act over smart. Okay, even though you are a very capable student and all of your seniors are going to be extremely impressed by you, and even your external professors will want you to do better than them, nobody wants you to do worse. When you are giving your examination, the examiner does not want you to be smart. Okay, so give how much is required. Don't go beyond. Don't start talking about something else. Don't try to switch the subject. Okay, please don't act over smart, but you have to be polite. And this be polite, yeah, so this be polite thing, what does it mean by be polite? Okay, it means you dress smartly. First of all, you wake up in the morning and you shower. I don't care if you've slept 1 hour, I don't care if you've slept 2 hours, 5 minutes. You wake up in the morning, you shower, you fix your hair, you fix your clothes, you put your hall ticket number, and you come. When you show up, you're going to say good morning, or you're going to say salam, or you're going to say good afternoon, whatever it is. May I sit? Then sit, and then thank you when you leave. I don't care how your vibe went, you're going to be polite to your professor. Okay, now, what happens is that in FMT, what I did, okay, was that I was giving wrong section numbers. Now you might think that I was like, no, sir, sorry, sir. So when sir asked me that, are you sure? I was like, yes, sir, of course I'm sure. I knew it was wrong. But yes, sir, of course, I'm sure scares the professor itself. Like, oh, okay. And then they give you more marks. And it might not work with everybody. That's true. It might not work with everybody. But when you can, please use this trick. Your target in practicals is going to be 80 plus. And as much as you think that you can cover it up with theory, you can cover it up with practicals, nahi hota aisa. It's not possible. You have to get both. You have to do well in theory, you have to do well in practical. This is why I'm telling you that sometimes in practical, it's good to know the people around you. They might not do the nepotism nonsense, but they do appreciate you for showing up. All of this revolves around being kind to people, thinking about people, thinking about theory from how an examiner is going to view it, and thinking about practical with again how the examiner is going to view it. You understood? All of this is done. You know how much you want to target. Again, it doesn't matter when you give the exam what you are expecting. Your target is 70 plus, so it's 70 plus in your mind. You give the exam, you come home, sleep, prepare for the next paper. Don't think about anything else. Now, these are some studying strategies that I really liked, okay, that I really used. The first thing is bed to desk. I am not somebody who can wake up early and study early and eat breakfast, nothing. But I am somebody who gets extremely anxious in the morning. Okay, I get so anxious in the morning that if I don't study, it will stress me out. So from the bed, I wake up, maybe like splash my face with water, come to my desk and start studying. No food, no brushing, kuch bhi nahi. Just come and start studying. Now, when you start studying into this, like when you see anxiety itself, anxiousness itself, okay, is an energy that you can use. It's a tool that you can use. Stop throwing it away. Stop wasting your nervousness. Okay. When you're overwhelmed, please take a walk. But when you are nervous, that time please study. So you're putting your energy into productivity. Understand? Okay. So now, even if you study half an hour over here, or 1 hour or 2 hours, lesser than your usual amount, how much ever you studied. Okay. Even if you studied 15 minutes, it's something you feel satisfied, you get a dopamine hit, okay, and then you stop feeling nervous. This will set your tone for the rest of the day, okay. Second thing is stop during overload. If you're sick, don't study, take the whole day off, don't study. I know 1 month is only left, one day how we'll take off. No, take it off. You only have community medicine, you only have forensics. I'm sure at some point you all might have studied something, okay. Okay, so if you are emotionally overwhelmed, okay, you got to stop. You got to stop, because when you're overwhelmed and you see something that is consistently making you overwhelmed, it doesn't become like a cure for it, okay. And then you'll start to associate that thing with negativity. It's okay to feel overwhelmed. So you stop, you go outside, you walk, you talk to people, you call your friend, you speak to your family members, and you do zikr. Okay, you do your morning askar, you do your evening askar, you do some other ibadah that you like. Okay, you read Quran if you like, you make dua if you like, you ponder alone if you like. Okay, something that people underrated is something that's underrated, sorry, is pondering. Okay, you look at the sky, you look at the sun, and you think, where is this coming from? Then you understand that these are the times where you understand that if Allah can create the sun and the sky and I am created, there is a purpose for me. This is the time where you build tawakkul. Understanding? Okay, we'll talk more about that in a bit. Dopamine detox is what I've been telling you guys. The mark last 10 years questions, the tick is going to give you the dopamine, right? Now, also, you remember how I showed you guys this slide? Now, what you are going to do is when you finish a chapter, okay, apart from marking the questions in the question bank, you're going to mark the chapter like this. When you do this, again, you're giving another hit of dopamine. Okay. Now, this is something that worked for me. So that's why I'm telling you guys. But yeah, okay. Now the next thing is shift. So something that really helped me was Discord VC. Okay, now you have your friends, and then or you do Zoom call or whatever. So you either do Discord VC or you do Zoom call or anything basically that keeps all of you guys together and accountable, and all of you guys are studying. So whenever somebody's studying, it would be like, I'm going on Discord, come join me. I'm there, I'm studying, you guys want to come, you can come. So it'll be like 11 of us, whoever wants to come can come. So even if there are 3 people, these 3 people are studying and the other people are also motivated. Okay. Now, I understand that there is this thing going on with medical colleges and just stuff in general, where sometimes people want to hide how much they're studying. Okay, or they want to say that nazar lagti, I don't, something like that. But you guys are not giving a competitive exam. Okay, the more you keep to yourself, the more you are not expanding it with other people, the more you are not recalling it again and again. If you don't teach others and if you don't hold yourself accountable with others, with friend groups and everything, you are not going to learn yourself. There is only so much a person can learn sitting on his own. And there is so much more that a person can learn by teaching other people, right? Okay, something that I really like doing was watching the sunset because I had the privilege to do so. In my building, there is a terrace. I could go up. Okay, it was safe. I had the privilege to watch the sunset or the sunrise or whatever, watch the nature, anything in general, and study using that. You guys might not have that. Completely okay. Somebody who has more than that, then please utilize all of these things. Okay. Even while you shift, even when I'm telling you guys, okay, do a Zoom call, go watch the sunset, balcony mein jao, do anything of this, associate these places with studying. Your desk should only be about studying. You study on your desk, you get up and you go somewhere else if you don't want to study. Okay. Right. So this is integration of studying with ibadah. Okay. Just give me a second. Yeah. Okay. Now this is integration of studying with ibadah. Okay. All of us are studying. If you ask anybody, and you'll be like, oh, why do you want to become a doctor? Especially in our city, especially in Hyderabad, right? And they'd be like, I want to serve people, I want to do this, I want to do that. But something that one of our senior doctors said was that you guys feel something for Palestine, you guys feel something for Gaza. If you guys were feeling something, you would be studying right now. Okay. As much as you think that community medicine or this subject or that subject is too much, it's useless or this, it still matters overall. When you get out of MBBS, get out of internship. I came from the Pulse Polio program volunteering today. SPM matters. You interact with ASHA workers. You see people from all kinds of socioeconomic classes. You have to build your view according to socioeconomic classes. That doesn't happen without community medicine. That doesn't happen when you don't have the exposure. You have to go outside your class. You have to go outside your social class, outside your academic class. You have to see things that are beyond your privilege. Okay. So for that, what you're going to do is you're going to first of all have niyyah. That is, you're going to have an intention that I'm doing this for the sake of Allah. Why am I doing it? Because I want to be a doctor and I want to learn more. I want to increase my ilm. Okay. Now, also, remember how I mentioned about tawakkul, how you're going outside and pondering and all. Okay. Apart from everything else, apart from the spiritual aspect, I need you guys to think about this from a mental health aspect. Okay. When you are struggling and when there is nobody to help you, nobody is going to sit and write your exams with you. Even Sadhan management won't do that. Okay. Nobody's sitting and writing your exams with you. You're alone. And at that point, you know that Allah is with you. At these points, you know that if Allah got you here to MBBS seat, आगे क्या हाथ छोड़ता है? You were meant for this field, whether you like it, whether you believe it, whether you don't, you were meant for it. That's why you're in it. Okay. What you believe for yourself doesn't matter as much. Okay. So when you build tawakkul, when you build trust on Allah, you are also releasing the burden of nervousness from your heart because you're giving it to something else. Okay. You are giving it to Allah. From a mental health perspective, you are freeing up mental space for yourself. Okay. Now, tahajjud. These are very basic advices that you might think, oh, it's so basic and everything. But when you are training to do something that you are not doing before, you're training to wake up for the tahajjud, you are also resisting your nafs. You are also resisting the nafs that wants to give into desires. You are also resisting desires in general. So you're waking up earlier to pray. So apart from a spiritual aspect that tahajjud, the dua, arrow never misses target. Okay, apart from that, you are also, from a mental health perspective, you are also training your body and your mind to do things that are against your desires, to create discipline in your life. Okay, this structure is not just for your spiritual health, but it is also for your mental health. Now, without your mental health, how is your physical health also going to work? Everything is interconnected, right? Okay. Now, obviously, namaz time pe paro. Please pray on time because you'll have that spiritual connection. It'll calm you down. And in any kind of, again, I'm saying spiritual aspect different. Farz namaz, farz hai, sabko ada karna hai, different. But also from a mental health perspective, you are showing up 5 times a day. You are showing up 5 times a day in front of somebody who wants to see you. you are leaving whatever you had to do and you are completely relying on something else. This frees up mental space. This gives you the strength to be alone, knowing that you're not alone. Okay. And now Salatul Duha is something that a lot of you miss. I'm sorry if it's getting a bit late. I feel like I should really tell you guys this. So yeah. So Salat Duha is just 2 rakat, okay, from after Ishraq, after sunrise, okay, 15 minutes after sunrise to 15 minutes before Zuhr time. That's when you can pray this 2 rakat. This, I need you guys to implement this and then see the results for yourself, okay? I'm not going to tell you what it's going to benefit, what it's going to do. You guys can read up and you guys can do it. Now, Azkar, you have to do it. When you're in constant zikr, you are in constant remembrance of Allah. You are in constant, you cannot do it. You can skip all of these things. It really doesn't matter. Like for you, you can skip all of these things. Apart from a spiritual aspect, why am I telling you guys to focus on the mental health aspect? Because when you're doing zikr, even if your mind is not present, some or the other time when your lips are continuously saying something, your mind will register it. Okay. And it will remind you. Why are we told to make so much dua? Kar li na main dua. I've prayed once to Allah. I've prayed once. Like, inshallah ho jata. Why are you told to repeat your dua? Have you ever thought about that? Every day you are waking up at the Tahajjud, you're praying that I want a distinction, I want a first class, I want all of this. Why do you think you're continuously doing this for the past 1 month? Do you not think that when you repeat something 5 times a day, that your mind actively tries to do it more? When you repeat something that, okay, no, I want, like, Allah, please give me distinction, please give, your mind is constantly associating SPM distinction, SPM distinction, SPM. You get me? Okay. So that is something that you guys need to keep in mind. Also, for all of you guys who are pitta stressed and aki like nazar lagti or whatever, anything, you can make rukya water. It takes 2 minutes. If anything, like, y'all can just DM me and I can tell you guys about it on WhatsApp, please. And then, yeah, you can just make that. You can have that every single day and do your daily Quran, because again, it's a habit that will build discipline. You can read one ayah, whatever. It's a habit that will build discipline. Spiritual benefits, all of you guys know. Me reiterating that is not going to fit it in your minds more. You all know the spiritual benefits of daily Quran, but from mental health perspective and how this actually adds up while studying is important. Okay. And one thing you guys have to understand, please understand that your life is very different from your friend's life, from your senior's life, from your junior's life, from everybody's life. Somebody will be going ahead in life, for what's good for them. Somebody might be going and they're not going ahead, they're just taking a different route. Somebody might be doing very well. You are getting nothing from hating them, not one single thing. Okay. They are smart, you are smart. Okay. All of you guys have different privileges, you all have different blessings, you all have different trials, different struggles, everything. The more you do this, forget the spiritual aspect for a second. Actually, never forget the spiritual aspect, but in this moment, your mental health, in your mind, you are constantly comparing yourself to somebody. For them, it doesn't matter, but for you, it matters. This creates anxiousness. This creates a competition which never existed. This competition that you're thinking only exists in your mind. Even if you give a competitive exam like NEET PG, there is no point in hating on somebody who's giving the exam with you. There's no point in hating on your friends. See, view it like a competition, view it like it's fun, but there's no point in having hasad for your friend. It's only going to ruin you, your mental health, and your time. You have 1 month. And as much as I'm saying that 1 month is enough time, because 1 month is enough time, I really want you guys to guess how much you all think I got in SPM for my first internal or my pre-final or something. Just guess. Put something in the chat box. Okay. I'll finish it fast. I'm sorry, I'm taking too much time. But yeah, so I just want you guys to guess that. And okay, let's move on. Okay, this is a dua list that you all can screenshot, or if the PPT is shared, then you guys can just use that. Okay, so these are conclusion and questions. So now this is what I want to talk to you guys about which book to use and everything. Okay, I cannot give you a timetable. There are people that have very nicely asked for a timetable. Cannot give you a timetable because I don't know your weak subjects, your strong subjects. Yeah. Okay. Yeah, so I don't know your weak subjects, I don't know your strong subjects, and I don't want to. Okay. There are some things that you have to do on your own. This is something that you do on your own. You figure out, you sit down with yourself, you ask yourself, do I know this topic? Do I not know this topic? Is this my weak? Is this fun to me? Is this interesting to me? That is your strong subject. Is this boring to me? That is your weak subjects. That's simple. Okay. Now, remember how I was canceling off the chapters and how I told you guys that it'll give you a hit of dopamine and everything? Finish the easy chapters first. I know everybody is like that, nahi, do the hard chapters first. If khatam ho jata, you'll be fine. Then you can do the easy one. You have something very, very easy like genetics, which you've been doing since first year. Very, very important, but very, very easy. Short question. This question you're definitely going to get. Finish genetics. It's going to take you half an hour. Even if it takes you 1 hour, even if it takes you 2 hours, doesn't matter. Your speed, right? Finish genetics. Hit that. Make sure that you are canceling that chapter from your question bank. When you do that, you're getting a hit of dopamine. Okay. So when you're doing this, you're finishing the easy chapters first and you're getting this dopamine, you are building that dopamine detox for yourself. So you are training your mind to have fun with the subject. Okay. Now, don't do donkey work, don't do stupid things. Just because I said I studied Park, just because somebody else says that Park is the best book, Park is the best book, no doubt. Please don't do national health programs from Park. You don't have time. I try to do that, okay? And I'm not saying, I'm saying it from the perspective that I'm a very average student. So when I looked at Park and I was like, national health program, 14 pages, I'm going to fail this subject because I can't do it, right? Okay, don't do this kind of donkey work. These notes, these manuals, these exam manuals, they are helpful when you have long, confusing and very factual based answers like this. Okay. And National Health Program is very scoring. And please, none of this advice has anything to do with NEET PG. NEET PG has a different way to study, and I'm not advising you for that. But for your prof exams, NHP, you should be doing from your notes. Okay. If you want to, I know some people who did it from Park and they really enjoyed it. If you are enjoying that, please go for it. Prefer what you enjoy, prefer what you like. Nobody can tell you what you like. Okay. And since I'm already talking about this, I need you guys to understand and pay attention and listen to me when I tell you stop taking advice from people you don't want to be like. Okay. Every senior is going to give you some of the other advice because every senior has gone through SPM. You don't have to take their advice if you don't want to be like them. A person who, whatever score they have, they will still enjoy giving advice. I like giving advice. I barely passed biochem. Okay, for example. Okay, I still like giving advice because it suits my ego. It makes me feel important or whatever it is. You get me? So I won't shy away from giving advice. You have to see who you want to take advice from. Okay, if in this whole PPT, the reading things or whatever, it doesn't work out for you, watching a video doesn't work out for you, Park doesn't work out for you, something else works out for you, do that. Don't take my advice. Take your own advice. Do what you want to do. All of this, how I've gotten a distinction in SPM and all of this, and how I've gotten first class in general and missed distinction by a few marks with other subjects as well, is because my goals were very different. My goals was that I need to know concepts. I need to clear my concepts. I have only used standard books during my MBBS. I have not used notes. Okay. That is because I enjoy it. It's fun for me. What is fun for you, you do. What your goal is, you do. If your goal is to get first class, you can get first class with basic notes. Okay. Completely okay. You don't have to do Park. It's not a compulsion on you. Okay. But is it possible to do Park in 1 month? Yes, it is. Okay, again, take your own advice. If you don't like my advice, don't take it. If you want parts of my advice, take it. If you want the complete advice, take it. Try it. Do what you want. Stop listening to the advice of people that you don't want to become like. Okay, listen to it. एक कान से दूसरे कान से फेंक दो. Okay, don't be rude to anybody because be nice to everybody. But apart from that, okay. Now this MCQ, a lot of people were doing Marrow, which I was also doing, Marrow and then custom modules, and they're making like a QBank and tests or whatever to solve the MCQs for the prof exams. Okay, your prof exams have such stupid MCQs. I'm so sorry, but they have very boring MCQs. These MCQs you're not going to find in Marrow. It's very different. Okay, and your prof exam is MCQs. It's either you can do it or you can't do it. It's a hit or a miss. Okay, so choose whatever. If you really want to have that whole dopamine thing going on, that, oh, I did 10 MCQs from custom modules and I got all of them right or something like that, then go ahead, do it. Use it wisely. Don't waste your time. Don't do donkey work. Don't sit and think of that it's your standard, it's your gold standard. No, it's not. Okay, you have to target 2 revisions before the exam. And these revisions, how you're going to do, you're going to open Park and say, no, you're going to have your voice notes. So you listen to your voice notes, you open Park and it's just highlights. So you're listening to your voice note on 2 times speed. Okay, and you are reviewing the highlights with your eyes. So you're using 2 senses. Okay, if you want, you can even mouth it, but it didn't work for me. So you're using 2 senses and you're revising twice. You can revise more times, how many other times you want. For me, twice I figured was the best number for me. Okay, these are some questions that people are going to ask. Okay, wait. So you guys understood, right? Like what are the books? Sometimes you're gonna have to use exam manual, sometimes notes, sometimes Spark, whatever you want to do. Okay. Now these are some questions that can I get distinction in a month? Yes, you can, because I kind of studied in a month. Okay, and since you guys, I don't know if you answered in the chat books, I can't see, but in my first internal, I got 8 marks. I got 8 on 100. Because does this mean that I'm stupid? Does this mean that I'm an idiot? Does this mean that I'm a slow learner, or like not like slow learner? Does this mean I'm lazy? Does this mean anything else? Does this mean anything negative about my traits? This just means 8 on 100, and I'm not at all embarrassed to say this. I got an 8 on 100, so what? But this means that I didn't know how to study the subject. And when you start understanding that nobody knows how to study the subject, is when you start taking interest in the subject. When you start thinking that if everybody hates it, then I am going to like it. Okay, then I have the I have like the upper hand. Okay, basically, it might be a toxic way sometimes to think about it, but it's also a fun way. And I like having fun with studying. I love enjoying studying. If I don't study, if I don't enjoy studying, or if I don't enjoy a paper, I don't do it. It's useless for me. Okay. Now, also, is Spark necessary? I explained to all of you guys. You guys have to make your own decisions. Is Spark necessary? Yes, from my point of view. You don't want to do it, don't do it. My friends study differently, or they do this book, they do that book. I don't know. FOMO and all you cannot have. You are a graduate student. Okay, you make your own decisions. You choose your own trials. Okay, your friends do whatever they want to do. Okay, after you finish third year and final year, you're going to have multiple books to choose from. Some friends are going to do easy books, some friends are going to do Harrison, some friends are going, you have to do what you want to do. You have to choose what you choose something, you stick to it. That's it. Okay. Who should I take advice from? Like I told you guys, people who you want to be like, you take advice from them. Otherwise, useless. Smart notes, amazing, beautiful notes. I love those notes. They're very quick, like, and they're just 2 lines, 2 sentences, easy to remember. Everything, beautiful, beautiful notes, and you have to purchase them, I think. But the thing about these notes is that the people who created these notes, okay, they uh they know the subject very well. You don't know the subject very well. If you just study from smart notes, you are not going to become smart. Okay, that was a very lame joke. But um yeah, so you're gonna have to study, you're gonna have to build your concepts, and then you can use smart notes. You can use it as a supplement to your main book, but you can't use it on your own. And I'm not saying you can't, as in you cannot. You can use this smart notes. I know of people who've used these smart notes and still got in first class. You can do it, but when you come to internship, you will lose that knowledge. Not because the notes are bad, but because the notes are concise. You want to build concepts. If you want to build, again, your goals, it depends on your goals. You want to get first class, finish it off, take notes and finish it off. You want to build concepts, you think that you can do it, then please go ahead and do it. Just have fun. Do whatever you want, have fun. Subscription accounts like Marrow, Prepladder, whatever. I personally used Marrow. I have been using Marrow since first year. That doesn't mean I'm a great student. It just means I like having fun while studying. Okay. So Marrow, definitely I would recommend and everything. And also third year, if you do this well, you will get a free subscription account from Prepladder or something of that sort. So if that counts as motivation for you guys, then please do it, because I did, and I got 3 months free Prepladder, which is not a lot, but it really helped me, and it really helped me with my final year. It really, really helped me. Okay. Handmade notes. Is there time to make notes from scratch? This, that. You have 1 month. Okay, there is no point in making notes. There is no point in making handmade notes. Okay. If you still want to do it, you can do it. But community medicine, as much as it's so much fun, it's amazing, it's vast, it's tiring, it's exhausting. You have to take multiple breaks. And for that, you have your digital notes. That's why I told you guys about voice notes. If not in any other subject, then in community medicine, you do voice notes. Okay. So hopefully I have covered everything. Let me just check. Okay, okay. I covered everything, I guess. Are there any questions?
We'll continue questions in a bit, ma'am.
Okay.
Jazakallah khair, Dr. Laha, ma'am. That was well organized and insightful, exactly the way we needed. You have made us realize that SPM isn't just about memorizing definitions, it's about understanding health as a collective responsibility. Inshallah, your tips will surely help us to study smarter and score better. Are you all still with us? Please respond in chat box. And now finally, it's your turn. We have heard two amazing speakers share their journeys and strategies. So if you have got doubts, confusions, or even small questions, don't hesitate. Drop them in the chat box or just raise your hand. This is your chance to clarify from those who have been exactly what you are right now. Let's make this session interactive and beneficial for everyone, inshallah.
Oh.
We have a question here that some Sufia is asking that how to make voice notes.
Should I unmute and answer?
Yeah, yes, sure, ma'am.
Okay, so like I told you, first read, second read, third read, video notes, everything. After that, you make yourself understand the question. Okay, like the simplest thing is type of family, right? So you make yourself understand the question. Then you record the voice note and you try to act like somebody is in front of you and you're explaining it to them. And if you are stuttering in between, and if you are like, if you get confused in between, then cut the voice note completely and restart the voice note. Do this as many times as it takes for you to be clear with the answer in your mind. Does that make sense?
Yeah, she said, yeah, okay. We have another question saying that do we really have to read SPM chapters in a specific order for better understanding, or we can go randomly?
No, absolutely not. Please go randomly. Please enjoy it. I liked screening. I started with screening. You don't have to start with epidemiology. You, if as long as you're using the videos and everything to understand, it should be fine. You can go through any order. You can do whatever. You can do paper one, paper two at one. Just do whatever you want. Like enjoy.
Someone wants to know that how to write an answer for non-communicable diseases chapter.
Okay, to
Answer
be
formation pattern.
very honest, this is something that since you all have been doing for second, third year, and also postings of final year, is something that like you should know. Like it's you just have to write about like the causes or like just stuff like that.
Yeah, yeah, sure, ma'am.
Yeah,
We get it.
I'm sorry, I'm trying to explain, but I don't know what to explain, and that it's just the state structure now.
Okay, okay, we get it. So, ma'am, we want to know that from where did you learn, like, read about national health programs? Because you said you didn't follow SPM, parks for SPM.
Okay, so you have Sia or you have Falcon or you have the smart notes. उसमें से जो भी अच्छा लगा उसमें से कर लो. Whatever short for you, just do that. If you want to do Park, you can do that also. If you want to do Marrow notes, you can do that also. Whatever short, whatever's fun for you.
Is it really possible to understand, have clear concepts in just 1 month and also score distinction, ma'am?
Yes, because I did it. So you guys can do it. I'm sure that you guys please do better than me. Please do much better than me.
Inshallah, sure. Are we supposed to fill pages even if you're out of points for like long answers, like the way we did previously?
The thing is, it depends on the question that's being asked, and it depends on how many pages you've already filled. If for an LAQ, if you've done 2 pages, that's like 4 sides, it's enough. And if for a 5 marks, you've done 1.5 like sides, that's also okay. 2 sides is what I would prefer with a diagram and everything. Space it out. For an LAQ, 4 is enough. And for a VSAQ, as much as you think half page is enough, no, write full page. Do something, but try to write. Unless they're asking you clear points. If they're asking you clear points, then okay, half page, 3 lines is okay. But otherwise, try to write at least 75% of the.
Okay, ma'am, sure. Thank you. Ma'am, actually, we have another question saying that what chapters from parks do you think are really good? Not marks wise, but will help us to gain knowledge.
Uh, I will be a little bit brutally honest over here. None of them. it's a very volatile subject. Okay, you have to keep revising it. Wherever you study from, if you keep revising it, you're going to remember it, right? So there's nothing that this Park has explained this thing very nicely. Maybe like when you study Oftal and all, you prefer Park over Khurana. Just something very basic like that. But there's no conceptual based thing that I would tell you to choose Park. Even statistics is difficult to understand from Park, which is why I'm telling you guys to do video and everything. And biostatistics comes in practical. Like comes for like good amount of marks. So
Actually, what chapters are really good to read from Park and like more conceptually, ma'am? Like you said, we can follow Sia and Falcon too, but mandatory which chapters are necessary for read from Park to score good, even for to gain concept knowledge.
just give me 1 second. I need to first open the. Can we take another question until okay, I opened it. Okay, it's fine. Okay, so this communicable, non-communicable, you don't have to do from Park. It's too much. You can do it from notes. Demography, family planning, do from Park because it has a lot of extensive kachra in it, which is good kachra. You want this because you're 100% gonna get a Viva question on this. This preventive medicine and obstetrics, pediatrics, geriatrics, it depends on you. I found it fun to read it from Park, but it holds practically no marks and it's easy for you to do. So you can use notes. Occupational health, please do from Park. It's brilliant. Healthcare of community, also from Park. This is a lot of fun. International health, also you enjoy Park because this is a short question. Even if it holds less marks, it's still you're gonna get a question from this. Do from Park. Health programs, no, don't do from Park. Communication for health education, do from Park. It's fun. And for all of these communications, audio, video, visual models, all of that, watch YouTube videos and all. You guys will enjoy a lot. This health planning and management, that also you can do from Park. If you find it difficult, then you can switch to notes. Concepts of health and disease, please do from Park. Epidemiology, or screening, all this do from Park. Health information, medical statistics. Statistics, you in Park, what you're going to have to do is that you're going to have to do your reads. When you highlight the points, you have to make your separate notes. For statistics, you're going to have to use videos, whether it's YouTube, Marrow Prep, whatever you're doing, you have to use videos. Social sciences, again, you can do from Park. Environment and health is very, very big in Park. Some if you are tired, I would even suggest doing the last 5 years. It's fine. Like qadar Allah. Like you cannot handle this. You just cannot. If you want to go for notes, please do that. Nutrition and health, you can do from Park. Again, they're gonna ask you stupid vitamin A, blindness, same thing. Hospital waste management, they only ask 1-2 questions out of it. Do from whichever book you want. And please draw diagrams and get color pencils also. Disaster management, do from Park. It's beautiful, beautiful. Genetics, you can enjoy with Park. Mental health, it doesn't matter. Yeah.
Okay, sure. And even like voice not voice I'm sorry, voice notes के लिए do we really need to explain without referring textbook or with textbook?
So mostly like 80% of my voice note, I did not need to look at the textbook again. But if I had a diagram, like a normal distribution curve, I would take a picture of that diagram, put it on the group, and then look at the picture and explain everything through it. So I didn't have to look at the textbook. But if you have to, it's still fine. Don't be so tight on yourself. It's still fine. Okay.
Which book is good for MCQ, ma'am?
Guys, I am Marrow user. I did not use book for MCQ since first year.
Okay, okay, ma'am. Do anyone have any doubts for FMT too? Like you wanna ask? Are you guys done with your doubts? Please respond.
Okay, I see this. Can I just answer that?
Yeah,
This
yeah, sure,
Park and
ma'am.
Siaka.
Yes, ma'am, sure.
Okay, the thing is that when you see stuff like, I think it was under 5 wala question or something like that, there's a bit of difference between Sia Falcon and Park. They give a little bit of wrong info. I won't say it's completely wrong, but it's a little bit wrong info. So unless you really need to use CI and all, I would suggest you stick to Park. And if you're asking, I don't think you're asking about biostatistics as the chapter. I don't think you're asking that.
So I guess that's the end. Alhamdulillah. With that, we came to the end of this another fruitful IMSA session.
Can I say
Had,
like one thing? Sorry, I'm
yeah,
sorry
yeah,
to
sure,
interrupt.
ma'am. Sure.
Guys, I didn't plan to get a distinction in SPM. Ophthal was my favorite subject. Okay, I know everything about Ophthal. I loved Ophthal. Okay, I didn't care much about SPM. I just enjoyed it. Okay, my goal was not about distinction. My goal was just to enjoy it. Okay, so if by any chance you don't get a distinction, you are still going to be a wonderful doctor. Who you make in the future is up to you. Who you become, who you or do all of that. Okay, distinction matters a lot. You get preferences for like medical officer jobs and everything. All of these things, they do matter, but if it doesn't happen, it's okay, it's fine. Okay, sorry.
we even want to ask that how do we revise before exam, ma'am? Like even for both subjects.
Jabin can answer FMT. For SPM, like I said, if you have these voice notes ready, even if it's not as detailed, even if you have some voice notes ready, it'll help you. And you do 2 revisions. One is 1 day before the exam. So, like how I would do it, for example, is paper 1 was today. I go home, I finish my 1 revision today. Okay, I listen to voice notes. I try to finish as much as possible. Then the next day I do the next. Obviously, this is very difficult and it's not that easy to do. So what you can do is 2 days before you do the the first revision, or like a week before you do the first revision, and 1 day before you do the next revision. 2 revisions mandatory.
Okay, ma'am. Thank you. Alhamdulillah. With that, we come to the end. We come to the
There
end
is a
of
question in the chat box.
yeah.
Can
Okay.
supplement Khazi Mudabbir with Narayan Reddy? Of course, for some topics, as Narayan Reddy is whole about the paragraphs and paragraphs and paragraphs. For previous year questions for LAQs, you can supplement it with Khazi.
And even we
And
want to know that how to revise before exam for FMT, ma'am.
okay, so I have already attached the 7-day revision schedule, and also make mnemonics, and remember the ways to recall, as Laha ma'am already said कि demotivate नहीं होना है, recall करो आप हर सुबह उठो फजर के बाद, and then recall what you have studied last night, and revise and revise and revise. Toxicology is very vast, clinical features, post-mortem changes and stuff. You need to revise more number of times to get a hang of it.
This Times Medical question bank can be studied, ma'am.
Yes, almost every question bank has questions repeating. It's every question bank is almost the same.
Okay. Do you guys have any more doubts that need to be asked?
Hello.
Laha ma'am, we have a question for you, like time management for SPM in examination.
It depends on what questions you know best. But what I did was that 40 minutes was for 2 LAQs. And then for 1 hour for the SAQs and the VSAQs, I'd finish it very, very quickly. That's what I did. But even though this time limits was in my mind, I would still give myself a 5-minute buffer. So even if I said 40 minutes, I need to finish it in 35 minutes.
Okay, ma'am. Thank you. Any more doubts or questions from anyone? Jabin ma'am, we have a question for you, that fatal dose of everything is necessary to be written.
No, only for LAQs and very important answers. Like if very important answer as in this questions is going to come. You will get vibes from the questions, right? कि ये तो आने वाला है कल. वैसे क्वेश्चंस और जो बहुत ज्यादा रिपीट हो रहे एग्जाम में, वैसे क्वेश्चंस का याद रखिए. मोस्टली LAQs, फॉर LAQs.
How is Bardell for FMT, ma'am?
I have no idea about Bardell.
Okay. Any more question, guys?
ये MCQ के बुक्स बोल रहे हैं ना आप लोग, गौरव ये जो भी है, I'm 19 batch, I don't know about these books, so you guys should ask your immediate seniors about this. Please don't do marrow MCQs for your prof exams. It's not going to come. Even if it comes, it'll be so stupid. Like they don't ask these kind of questions. The marrow questions are very different from what they ask in prof exams questions. So it's unnecessary work unless you enjoy it. If you enjoy it, then do marrow MCQ.
I would suggest BNS section as it is the latest one.
So, and I guess it's time to conclude. A heartfelt Jazakallah khairan to our wonderful speakers, Sister Jabeen Mustafa and Dr. Laha Sayed, for their time, wisdom, and warmth. Your words are truly inspired and guided us. And we pray that Allah continues to bless you both in your journey ahead. Ameen. As we leave today, let's carry forward what we have learned, not just study tips, but the initiation to seek knowledge for the sake of Allah, to heal with humility and to grow with gratitude. And to all our participants, may Allah make your third year journey easy, fill your studies with barakah, and grant you success that benefits you and the Ummah. Always remember, when you walk with the intentions to seek knowledge, every step you take is a step towards Jannah. Thank you once again, everyone, for being the part of this beautiful gathering. Wassalamu alaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
You can leave the meeting now.